Okay, so you're at the point where you need to start an IV. If you aren't comfortable yet starting IVs, the most important thing to do is not to panic. If you're going to start an IV, you need to go in with a confident attitude, and this process will go a lot smoother. So you'll want to have all your supplies ready before jumping in. The supplies that you'll need are going to be gloves, a beveled needle with catheter, an IV start kit, which typically includes a Tegaderm patch, gauze, a skin prep cleaning agent, tape, and a tourniquet. You may also need a 10 milliliter saline flush, which can then be used to determine whether or not you're in the correct location and vein patency. You may also want to tear your tape into strips, so you'll be completely prepared for the end. To begin, you'll want to find a suitable vein. There are numerous veins that can be poked, but the most common veins will be on the upper extremity, mainly your antecubital fossa and the dorsum of the hand. There are a lot of different tricks that seasoned IV veterans use to make the veins bulge out, but a few of the more common ones are going to be asking the patient to clench and unclench their hand, 5 or 10 seconds. Another trick is going to be to have the patient hang their arm off down by their side for a few seconds to increase blood flow down to the hand. Some people prefer to tap a vein, which may help also reveal a good vein. So either of those techniques are what is commonly used out in practice. But don't be spending too long looking for a good site, since patients expect you to know what you're doing, even when you may not be a pro. So let's begin an IV start. To begin, you'll need to apply a tourniquet. There is no magic location on where to place the tourniquet, but as a rule of thumb, you want to apply it about half an extremity proximal to the puncture location. So in this example, if you want to start an IV on the dorsum of the hand, then you'll want to tie off approximately at the middle of the forearm. Since we're going to be doing the antecubital fossa, just halfway up the humerus is going to be fine. I'll demonstrate one version of the tie of how to do that. So for this, you'll want to make sure that the tourniquet can be removed by one hand only. So to tie it, you'll be taking both sides, as demonstrated, and then crossing over, and then tie it off so that way